Hey guys! In this video I'll be explaining the mechanisms of birth if your baby is positioned head down. I'm going to start by explaining different ways that your baby may be lying if they're head down and what that can mean for labour. If your baby is transverse, lying across, or bum down, breech, I'll be looking at that in module 4. So this is my baby, Pip. We're going to be assuming that Pip is head down in this video. Isn't that enough for a good labour? Everybody knows that a head down baby, it's a little bit simpler, but there's a bit more to it than just head down. So we're going to start with assuming that Pip is lying towards the front of my tummy. So we'll start with Pip's back being at the front of my tummy. So this is known as the occiput anterior position. The occiput is the back of baby's head, and anterior just really means the front of your body. And in this position, for first time mums, it's great for a baby to be lying on the left. And I'll explain a bit more about that in a minute. So when baby's lying at the front, on the left, towards the end of pregnancy and during birth, your baby can tuck their head in beautifully with their chin to their chest. And they have quite a lot of manoeuvrability in their neck, so they can really tuck that in. And what that means is that the presenting part on your cervix during labour is the smallest diameter that the baby can achieve, and that's 9.5 centimetres. And that's brilliant for birth because it fits down more easily into your pelvis. So if it's a smaller diameter, of course it's going to fit more easily. So we're going to look also at the way that they're directed. So when they're lying at the front like this, their heads are directed actually at an angle backwards, and often we just think about the neck of our womb or our cervix being straight down like this, but it's actually tilted backwards. You don't always see that in biological, diagrams. You see the cervix coming down, but it's actually tilted back. So we can understand that if your baby's lying like this, their head is angled towards the cervix. So they're putting really good pressure, they're well applied to the cervix, so that when you're in labour, it's really encouraging the cervix to open, which is fantastic. So now we're going to turn Pip head down again, but this time we're going to lie Pip back to back. So that might be lying on the right, or perhaps more likely on the left, back to back. So in this back-to-back position, Pip's head, because it's not flexed right in, actually it's presenting with a larger diameter down onto your cervix, and the average is 11.5 centimetres, which means that fitting through your pelvis is a little bit trickier because obviously it's larger to fit through the space that you have. The other thing that you'll notice is that when Pip is lying back to back, then the way that Pip's moving is actually more straight down as opposed to towards the cervix. And when you're in labour, this can mean that actually the baby's being pushed down, but the pressure that's coming is more on the front segment of your womb and your uterus, and not so well applied back onto your cervix. So in medical terms, this is called occiput posterior. So the back of baby's head is at the back of mum, the posterior part. And you'll quite commonly see this known as the OP position, or in this series I'm going to call it the back-to-back position. So what does this mean for labour? So I'm a working midwife, and I'm sure if you're watching this and you're a midwife like me, who supports birthing women, you've seen so many back-to-back labours. And so what does this typically look like? I'm sure midwives will recognise this kind of birth. So mum will feel typically the contractions or surges in her lower back at the beginning, and a little less at the front probably. Mum may feel an intense grinding sensation at the front, and what this is during the early stage of labour is where actually the baby who's lying back to back is really desperately trying to turn, and you're feeling that grinding sensation under your pubic bone or your symphysis pubis, and that can be really uncomfortable. Early labour, or when the cervix is going from being long to short, and then when it starts to open up to 3 or 4 centimetres, it can take quite a long time for the back-to-back baby. And by a long time, I mean, 12 or 24 hours. Sometimes it looks more like 2, 3 or 4 days of labour. Now, during that time, of course, mum won't be having regular contractions the whole time, but what she might typically see is contractions that are coming every 3 to 4 minutes for an hour or two. They seem regular, it feels like strong labour, and then they go off for an hour or a few hours where she can maybe get a little rest, but maybe not, and then it starts again. So it's quite an irregular process, starting and stopping. As you can imagine, this kind of back-to-back labour is pretty exhausting, and it leaves mum worn out without much reserve for the strong labour that will follow and the pushing part of birth as well. I've seen it countless times when mums, they come into hospital for a check, they're seen to be 1 or 2 centimetres, but they feel like they're in strong labour. They're told that it's early labour and they're sent home. And sometimes they come in once or twice, and that can be so demoralising, and it's just very, very tiring, of course. So why does it present like that back-to-back labour? If the baby is lying at the back, like so, he or she is really doing their best to turn and flex their head so that they can push down really well on the cervix, and that it will open and they can continue their birth journey. Babies are really smart. They know the easiest and best way to be born, and it's only a small turn, but it can take a really long time. Jean Sutton, the wonderful midwife and mother of optimal fetal positioning, noticed that the rate of posterior presentations, babies lying at the back, has really increased drastically over the last few decades. And that ties in with the change in our lifestyle. So sitting in our cars, leaning back at our desks, and relaxing on our comfortable sofas, they really produce that posterior position, or the back-to-back baby. Back-to-back presentation is a real problem for first babies. If you've had a baby already, there's a bit more space, there's a bit more manoeuvrability, and quite often baby will manage to find its way to the front. However, if you have had that kind of back-to-back labour before, the chances are you'll probably may have one again. Many mums, especially first-time mums, they don't really know the position that their baby is in inside, whether baby's bottom down or head down, whether baby's lying at the back or at the front, and it can be quite tricky to know. So when you see your midwife after 30 weeks of pregnancy, I would ask them, or your doctor, to tell you where their baby's lying. They can feel your tummy and give you quite a good idea. There's also a really good indication that your baby is lying at the front if your tummy really sticks out beautifully. So we don't want a neat bump. We want a really nice forward-leaning bump, and that tells us that your baby's at the front. The bump that's very neat and tidy, and maybe you look a little smaller than your friends or other people that are pregnant, that tends to be a baby that's lying back to back. If baby's at the front, your tummy button might well stick out a bit, because it's being really stretched, and that is normal. If your baby's at the front, quite often you feel your kicks on the side. You might feel a little foot somewhere between your hip and your ribs, and that is a really good sign that your baby's in a good position. With a back-to-back baby, you tend to feel a lot more kicks at the front because, of course, baby's head down, you're feeling those legs and feet wiggling around at the front. Research suggests that about 87% of babies will need to turn, and do turn, during labour to be born. It's just that that turn can take a really long time and it can be really tiring. In the 5th module, I'm going to give you a systematic method to follow so that you can really encourage your baby to turn if in labour you find that your baby is back to back. And in the next module, module 2, I'm going to teach you the Align Your Baby Lifestyle 6. 6 simple things that you can do really easily to encourage your baby into a better position for an easier birth. I'll see you there.